Welcome to the audio workshop for February 2010. This is Dr. Mike Bucknell, and of course, if you're getting this audio, you are either a patient or you are handed it from a patient, and we appreciate them doing that and sharing the message with you so that we can lead you toward a better way of living and really getting the most out of your maximized life. So the purpose in this audio workshop is really to get you the information that you're not going to get in the typical media, that you're not going to get listening in most other formats yet, provided in a means to our patients to where you can really get the information that you require without spending hours in consult. And it allows me to reach everybody on a one-to-one level as well, and really make sure that I'm getting all the information I possibly can to my patients so that they don't continue to take this, do the same mistakes that most people are following through on. When you look at even patients under chiropractic care, you find that so many of them are still taking heart disease medications. They're still taking cholesterol medications and blood pressure medications. And that's just really disturbing to me because it misses the entire principle of what chiropractic is all about and the level of personal responsibility that's involved. But, of course, where most of you are is, okay, so what do I do about it? Because, likewise, most people are not going to move. They're not going to change until they feel security with where they're changing to. So that's the entire purpose in today's workshop, is to give you all the information that you need to know, number one, what you're doing is not working, and number two, what you can do about it starting today. So, the topic again, of course, is heart disease and all of the lies and deception that go along with it, and all of the guidelines as far as marketing and how it's gone about. So, I want to start off with a few statistics. According to the CDC, the Center for Disease Control, these are some of the statistics that they list off. Heart disease is now the leading cause of death for both men and women. Okay, 29% of U.S. deaths are from heart disease alone. Death rates are 30% higher among blacks than they are whites. All right, 71% of all heart disease deaths are coronary. Okay, that one's really important when we get down further into the workshop. Just think about that. You always hear coronary heart disease, not systemic heart disease. Okay, that's a major point there. Okay, heart disease costs us more than $258 billion, including health services, medications, and lost productivity. So worldwide, coronary heart disease kills more than 7 million people every single year. So the bottom line, if there's diseases to be, if there's wars to be won, it is not on the battlefield. The real wars to be won are with what's going on with people's health these days, because we see so many people dying needlessly from heart disease and cancer and diabetes and obesity and the worst of all, medications, and all the lives that are lost from the way that medicine is prescribed and used. It's just an absolute travesty, So until we change the way that we go about things and we get an understanding out there, we're not going to see a difference. So Forbes magazine listed off the top selling drugs. I want to list these off to you, okay? Number one is Lipitor. Of course, that's a cholesterol drug, grossing $8.4 billion, okay? The number two selling drug, Zocor. Guess what that's for? You got it, cholesterol. Cholesterol drug grossing $4.4 billion. The next drug is Nexium. That one's for acid reflux, grossing $4.4 billion. The next drug on the list, Prevacid, another acid reflux drug, grossing $3.8 billion. The next one on the list is Advair, which is an asthma inhaler, grossing $3.6 billion. The next one is Plavix, heart disease medication, grossing $3.5 billion. And the last one is Zoloft, which is, of course, a depression drug, grossing $3.1 billion. Interesting, when you combine all of the depression medications together, depression drugs are actually the highest grossing category of drugs out there, even beating out heart disease. But we're looking at the individual drugs there. So what we have is a situation where the top two selling drugs in the United States are cholesterol. So I'm going to start right there because obviously, this is a big issue. More people are, they're making vastly more profits on this than anything else. So it must be true, right? Okay, so here's where we're going to get started. The People's Chemist, first of all, reports cholesterol-lowering drugs can increase the risk of cancer. Studies show they mimic the growth factor VEGF, which is vascular endothelial growth factor, which is a cancer fertilizer responsible for its proliferation. So this growth factor within the body literally it feeds cancer and allows it to grow and proliferate all throughout the body. So it's actually evidence pointing to cholesterol-lowering drugs actually increase cancer by that merit. The British Medical Journal has reported that only 30% of statin drug trials have reported the number of participants with one or more negative side effects caused by the drug. Okay? So what that shows is that, 1/3 of the case, they don't even report the side effects that people experience. So when you're watching the TV and you're seeing all those drug side effects listed off, you're only getting 1 in 3, or I'm sorry, 2 in 3 of those. But 1 in 3, they're not even reported, so you wouldn't even know anything that's going on there. Okay, but that doesn't really have anything to do with the effectiveness of the drug, right? Now, I mean, what we want to know is, okay, so they cause side effects, so they cause cancer, but are they effective? If they're effective, then well, isn't that worth it? Well, according to USA Today, statins have killed and injured more people than the government has acknowledged. Okay? For example, taking the statin Crestor, also known as rosuvastatin, if we pronounce that right, of course they make them impossible to pronounce, it slashed the risk of heart attack by more than half, according to the Jupiter results. So what they're saying is that taking Crestor slashes the risk of heart attack by more than half. Okay, by this study that was published. Okay, but the truth, according to Dr. Mark Hlatke of Stanford University, told the New England Journal of Medicine that absolute differences in risk are more clinically important than relative reductions in risk used in the media deception. Okay, and what that means, we're looking at the difference between absolute difference and relative difference, okay? Well, absolute difference is actually looking at the numbers. So if 1 in 100 people developed a side effect, then it would be 1 in 100. That's absolute difference, okay? But the relative is they start adding in all these other factors to change the overall appearance of the study. So they might, use particular factors to break down to say, 1 in 2. Which would give you, instead of 1 in 100, you now, change the data and make it a 1 in 2 relative risk. And of course, now you show a 50% reduction because it appeared to make a difference in one of those two people. You get the difference there? So what was the absolute difference according to Dr. Mark? 0.9%. Okay? These drugs, Crestor, which is one of the top selling drugs, 0.9% difference in absolute risk. Now tell me, why in the world would you spend the kind of money that people are spending on cholesterol medications to get less than a 1% difference in your overall health? It is absolutely ridiculous. Okay? If Crestor, on the other hand, were used over a patient's lifetime as recommended by the Jupiter study, it would cost them over $500,000 to maintain the use of this medication. All right, so bottom line, if cholesterol was the problem, then why is it that 90% of the time heart disease is caused by narrowing of the coronary arteries of the heart alone, while the rest of the arteries, veins, and capillaries remain completely healthy despite being rich in cholesterol and fat? Okay, think bypass surgery for a minute. You go in for a bypass surgery, and they tell you that what we're going to do is we're going to actually take a vein or an artery out of your leg, okay, and we're gonna put that into your heart. Okay, well, if the cholesterol thing was true, well, how would they be able to take an artery out of one area of your body that's also got cholesterol, floating all throughout your body that should be damaged as well, and put it into a different place? You get what I'm saying there? I mean, if cholesterol was a problem, you would have the problem everywhere. It wouldn't just be in the coronary arteries. You couldn't just take a perfectly clean artery out of one or vein out of one part of your body and put it into a different part of the body. It just wouldn't work that way. So clearly, the science here is just so iffy. It's really just a giant house of cards. Okay, so cholesterol lowering drugs also decrease coenzyme Q10 levels within the heart. Now, this nutrient is absolutely essential and serves as an energy producing molecule. It's crucial to proper cardiovascular function. You have to have it. So without coenzyme Q10, the heart actually fails. So these cholesterol lowering medications actually deplete a vital nutrient that will actually cause heart failure. Okay? They say congestive heart failure is actually the outcome when this occurs. So, they find this research out. What do the drug companies do? Of course, they start adding coenzyme Q10 to their medications so they can, instead of acknowledging that they made a mistake, that the science is faulty, and getting rid of the medications and telling people, hey, you know what, it didn't work. You're selling too much of it. All they're going to do is change it. They're just going to add something to it, but they're never going to accept the error in the first place. Okay? Now, cholesterol works to ensure the integrity of the myelin sheath of the nerve system. So get this. The nerve system breaks down in the absence of cholesterol. Now, what is the most important system in your entire body? That's right, it's the nerve system because it controls absolutely every other organ in the body. Yet, when you lower cholesterol, you're actually breaking down the myelin sheath, which is the conduction material around the nerve that allows signals to process across that nerve. You're breaking that down, okay? Now, let's get in further. More than half of people who suffer from heart attacks have low cholesterol. And high cholesterol levels at 300 to 350 milligrams per deciliter is a natural and healthy part of aging. The higher total blood cholesterol, the longer people live. Okay, this is research. More than half the people who suffer heart attacks have low cholesterol, not high cholesterol. They're showing that higher cholesterol actually means that you live longer. We'll explain that here in just a second. So, the European Heart Journal, going further, published a 3-year study of 11,500 patients, finding those with low cholesterol to have a risk of all-cause death 2.27 times higher than those with high cholesterol. All right? So we're looking at all deaths from all different kinds of disorders, and if you have low cholesterol, you're almost 2.5 times higher risk of dying from anything than if you had high cholesterol. So, erase everything that you've heard about cholesterol medications. What does that tell you about cholesterol? Is it good for you? Is it bad for you? Low cholesterol increases risk of death. High cholesterol lowers rate of death. It's pretty clear when you start looking at this research that cholesterol is a good thing. Like I said, I'm going to explain that here in just a second. But let's go on a little bit further. The Journal of Cardiac Failure published an analysis of 1,134 patients with heart disease and found low cholesterol to be associated with the worst outcomes in heart failure patients and impaired survival, while high cholesterol improved survival rates. Once again, another study, over 1,000 patients, they found that high cholesterol actually improved outcomes. The American Geriatric Society reported in 2003 that in patients over the age of 65, even cholesterol levels up to 417 milligrams per deciliter were associated with lower mortality compared to levels under 189. So we have all these studies that are pointing to the same exact thing, that cholesterol is actually better to have higher than lower. Now, addressing that, do you want your cholesterol higher? The answer is no. Because cholesterol is there as spackle within the body. It's there to deal with issues, to deal with problems. But the key there is it's there for a reason. Okay? That's the most important thing. Your body is what's producing cholesterol. So if you don't have enough cholesterol, you can't repair the problems that are there in place. So it's absolutely essential to make sure that you have high enough cholesterol levels if it's supposed to be there. By doing the damage to the body, and that primarily we're doing through lifestyle and diet and stress and chemical toxicity and all these other factors, you do this damage, but then the one substance that the body creates to deal with that damage, you lower it just because you want to see a number go down. Can you see how that is just, it's a completely ridiculous concept. It does not involve any level of doctoring the problem at all. It's just basically throwing a Band-Aid at a problem. You've got to address why is the problem there. Lowering the number does absolutely nothing except on paper. So, in summary, the cholesterol myth is a lie. It will kill you. If you continue to take cholesterol medications, the research is absolutely clear. It is not going to solve the problem. And if you're not going to solve the problem, if you're not actually fixing the issue, then why would you continue to take the medications? Where there is no viable benefit, there is no acceptable risk. Okay? So, let's move on to the next thing, blood pressure. Okay, all right. John Abramson, MD of Harvard Medical School, said these drugs have been on the market for 21 years. They are the best-selling drug class in history, and yet there is still not a single study that documents a health benefit to women of any age or men over 65 who don't already have heart disease or diabetes. Okay? So they do not benefit women of any age or men over 65. So who does it benefit? It benefits men below the age of 65, apparently, but we're not sure. Okay? And really the only studies that I've seen that actually show any kind of benefit whatsoever would be in men who have already had a heart attack below the age of 65. So it's just, it just is mind-boggling that, the blood pressure issue, it used to be at one level, same with cholesterol. You used to have these levels that were higher, and then they lower the levels, and they lower the levels, and they lower the levels, and every time they lower the levels, more people now get on the medications because they're now below the new line, right? So yet these studies are conclusive. They're not showing any kind of benefit in the long term. Of course, anybody logically thinking is going to see that's going to be the case because you're not dealing with any kind of problem that actually forced the issue. How about changing diet? How about getting rid of the toxins? How about seeing how the body is functioning? They don't look at any of that. All they do is give you a drug and say, here, this is going to help. So another study, Prosper, it was a study sponsored by Bristol Myers Squibb, suggests no longevity benefit from taking a statin, period. So now, think about this. If there's no longevity benefit, if it's not going to increase your lifespan, then why in the world would you continue to take it? The very reason why the doctors are telling you to take these blood pressure medications is because they're saying you're going to die from a heart attack. Yet their studies are showing that it doesn't improve any longevity benefit whatsoever. So if it doesn't do what they say it's going to do, then why do it? It's just these are simple one-to-ones. So going on, drugs such as Toprol XL, low pressor, Tenormin, and Coreg serve as fat fertilizer to the human body. So they actually make you increase weight gain, which now, of course, leads to the problem even more. So I want to actually explain how this works because that's what's important. Now you know the blood pressure medications don't work, the cholesterol medications don't work, but what do you actually do about it? Okay, so the first thing I want to give you an analogy of is if you've ever, one of the restaurants we like eating at is Ruby Tuesdays, okay? Particularly the reason why I like Ruby Tuesday is because they have these delicious fruit teas, okay, where you could go in and you can get strawberry and blackberry and peach and mango, all these different flavors. This is not an ad for Ruby Tuesdays. We just like eating there because, it's one place that you can actually get something other than soda or water. So, we get our unsweet teas with say, strawberries in it, okay? And you're drinking out of your glass, and you guys have all been here, and you get down, and all of a sudden you suck in a strawberry, okay? And the strawberry gets stuck in the bottom of the straw. All right, so what do? Do you, at that point, do you ask for, some kind of, I don't know, some kind of seasoning or some kind of, straw or whatever to go in and poke around at it, or do you, some kind of chemical that's going to dissolve the strawberry? No, of course not. You do the simple thing. You suck harder. Right? You just suck harder, and what happens? Because of the pressure gradient, the strawberry actually gets sucked into the straw because you need more force to do it. So anytime anything's stuck, you use more pressure, and that pushes it through. Simple analogy, right? Okay, well, now, of course, maybe that doesn't apply 100% with blood pressure, right? Because not something stuck in your arteries per se. On the other hand, if you look at it this way, it's really relevant to, let's look at it a different way, as a garden hose. Okay, so you've got a garden hose that you've got stretched across from your house to your driveway. All right, and in order to power your hose to wash your car, you need a particular amount of pressure getting through. Not pressure, a particular amount of water. Okay, think about it in liters per second or liters per minute. Volume per amount of time. Okay, so you have to get a particular amount of water from point A to point B in order to wash your car. Well, what happens if you remove your garden hose and you put in a hose that's only half the size? Okay, it's only got half the diameter of the original hose. Now you turn on the water, and what happens? Well, you have the same pressure at the end back at the house, but the hose is now smaller, so you can't get the adequate amount of water from point A to point B. So at point B, you're seeing a reduction in overall quantity flow to that, whatever task it is you're trying to, do, wash your car or whatever. Okay, so how is that relevant to the body? It's directly the same, because you've got your heart, which is pumping at a particular pressure, correct? Okay, you've got your arteries, which are a particular diameter going from point A to point B. Let's say point B is your brain. Okay, and we know that the brain requires a particular amount of oxygen. Actually, your brain requires 80% of the oxygen pumped throughout the body. 80% is absorbed within the brain itself. Incredibly powerful. So here you have a situation where you've got point A, the heart. The point B is the brain, and you've got an artery in the middle. Now take those arteries and inflame those arteries all the way through, actually shrinking down the diameter of those arteries on the inside. What happens? Well, naturally, you're not going to get enough oxygen to point B, which is your brain. So what does your heart do as a result? Well, it's pretty simple. The brain sends signal back to heart saying, hey, I'm not getting enough oxygen. Heart responds by increasing pressure force, so it beats harder. And what happens as a result? Your blood pressure inside the arteries actually increases in order, as it's pushing more blood flow through to the rest of the body. Now, you go into your doctor, and he takes out a blood pressure cuff without assessing the inflammation in the arteries or any other factors that might be going on, simply puts a cuff on your arm and measures your blood pressure, and then looks at a book that says this is where you should be in terms of values. Actually, it's not even books anymore. Now it's according to the drug companies, since they keep on lowering the values. And he says, well, your blood pressure is too high. So we're going to put you on these blood pressure lowering medications. You get on the blood pressure lowering medications. Of course, they do exactly what they're designed to do, because that's how drugs sell. And the number comes down. You go into the doctor, your blood pressure is now lower, and you say, amen and hallelujah, my problem is fixed. All right? Except what is the problem there? You got it. Exactly. You have actually robbed your brain of oxygen because you're not getting proper amounts of oxygen through to the tissues because you artificially lowered the blood pressure. So if you didn't get all that, you might want to rewind it and listen to that about 3 or 4 more times until that really sinks in. So medical literature shows that as we age, blood pressure rises slightly, and this increase does not put us at any risk of early death whatsoever. So even though even if blood pressure does increase studies show it's not really a big deal anyways. What happens if you were to go running? Oh my goodness, please do not go running before you go and see your doctor and get your blood pressure taken, because your blood pressure will be higher. That's right, when you exercise, when you do something that is actually stressful to your body, naturally your blood pressure increases. Okay? It is completely natural for the first number, the systolic number, to be 100 plus our age. So, being that I'm 30 years old, my blood pressure, it would be completely normal for my blood pressure to be 130. But wait a second, hang on now. Normal blood pressure range is 120 over 80, right? 120 over 80 and I'm at 130. Oh my goodness, I've got high blood pressure now. I better go and get on medications. You see the baloney behind that? It's unbelievable. So it doesn't address the cause. The period. It just doesn't address the cause. So if it doesn't address the cause, just like cholesterol, it will kill you. Okay? Plain and simple. It will kill you if you continue to take a drug that is having all kinds of side effects and is actually masking over the actual problem. You don't fix the problem goes uncontrolled. So how does all that inflammation, diabetes, and blood pressure all go together? You're pretty much looking at the same problem. Diabetics actually have 4 times the risk of heart attack relative to non-diabetics. All right. Studies find that Avandia users have a whopping 30 to 40% increased risk of heart attack and other heart-related adverse events like heart failure compared to patients treated with placebo. So you take the medications for diabetes and you actually increase your risk of heart attack. Another one, just a double standard there. Patients who follow doctor's orders and swallow beta blockers and diuretics are at a 28. Why do you do that? Of course, again, beta blockers, those are blood pressure medications, just in case you don't know. Diuretics also, what they do is they leach water from your body. They actually cause you to leak out water, and pee a whole lot more than you normally would. Thereby, of course, the theory there, notice I say theory, is that if you reduce the water supply in the body, of course, you're going to lower the pressure of that water in the body. Hey, it does make sense, and it's gonna reduce the number. But the problem is, you kind of need water in your body, right? You've heard that your body is mostly water. So, of course, you reduce the water supply, you reduce your hydration levels, and organs and muscles do not function or heal properly. So let me repeat that again. Patients who follow doctor's orders and swallow beta blockers and diuretics are at a 28 to 50% greater risk of suffering from type 2 diabetes. Okay? 28 to 50% increased risk of diabetes. Over time, blood sugar reacts with amino acids floating nearby. The product of this reaction is called advanced glycated end product. Okay, it's called AGEs. And what that does, so that blood sugar, it creates these AGEs, and they go through your arteries and they cut and they stab at your artery walls. Okay, so they create damage. So here we go. Follow the process. You get blood. You eat the wrong foods. Your blood sugar increases because you're not burning those sugars faster than you're putting them in. So that increases this end product called AGEs in the bloodstream, and then those AGEs go through and they damage your arterial walls. Well, okay, so how do you fix that arterial damage? Here's where the magic comes. It's called cholesterol. You got it. Cholesterol works like spackle for the artery walls. It's literally just like spackle. Your body increases cholesterol in order to go back and repair that damage. So naturally, if your cholesterol is increasing, what is that telling you? That's right, it's telling you that you're doing damage to your arterial walls because you got stuff in there that should not be there. So how do you lower your cholesterol? It's pretty simple. You get the stuff out of your bloodstream that isn't supposed to be there, and your cholesterol lowers by itself. That's why diet makes such a dramatic effect on cholesterol levels. When you go on a raw or a vegan or a vegetarian or even just, it doesn't have to be anything extreme like that. You just cut out the junk and your cholesterol numbers start to lower down. Okay, now let's say you are diabetic and you just decide to inject insulin or take drugs. Well, it does nothing to reduce the level of sugar going into the body. So you're not really reducing the blood sugar at all that's going in. All you're doing is trying to cram more of that sugar into the cells. So what's the only thing that can reduce the amount of sugar going in your bloodstream and therefore the ages being produced? It's pretty simple. It's your mouth. Your mouth is the only thing that can do it. You've got to stop eating, and you've also got to start using your legs and start burning off the sugar that is already there in your cells. You put those two things in combination, there's nothing more powerful. So doing the above, it causes your body to stop producing insulin naturally and normally. Anytime that you introduce something into the body that is not supposed to be there, the body has to then respond and change itself in order to adapt to that situation. Well, if your body is producing insulin to deal with blood sugar and then you start pumping it in artificially, well, then your pancreas says, hey, I don't need to produce insulin anymore. It's already there, so it stops producing. Now you've got pancreatic failure. It's not really doing what it's supposed to do. The same thing goes, let's look at the blood pressure issue. You increase blood pressure medications, your blood pressure goes down for a while, and then your brain starts to adapt saying, hey, wait, I said I need more oxygen, and now the blood pressure is going back down. You got to kick it back up. So your body starts to fight that blood pressure medication. So now it's both fighting the medication and it's trying to increase your blood pressure at the same time. So now it's doing even twice the amount of work. So we put all these things together, and here's what it comes down to. If you continue to take blood pressure medications or cholesterol medications after listening to this, I don't know what else I can say to you. There's really nothing else I can say. You've got to sit down and you've got to read this and listen to it and listen to it and listen to it over and over and over and over again. Spend hours and hours of research on the internet. But the bottom line is, you've got to start taking responsibility. You've got to start taking responsibility that this is a situation that can be handled if you do it the right way. But I know why most people won't do it. It's because they see it as taking work. And eating the ding-dongs and ho-hos and hot dogs and drinking soda, that's fun and that's good, so we go ahead and continue to do that. And, hey, it's easy to just pop a pill. But you know what? Are the ding-dongs and ho-hos more important than spending a few extra years of life on this planet with your wife, kids, and grandkids? I highly doubt it. If that is the case, I'm really sorry, and we need to talk about that on one of the future workshops. Definitely pick up a copy of the Max Mind workshop. That's where it would be relevant. But for most of you, I know that's not the case. That this is something you've got to realize right now. It's time to act. It's time to do something about it. So how do you start to deal with the issue? Number one is neurological function. You've got to look at neurological function because the nerve system literally controls absolutely every single function in the entire body. Now, I'm going to divulge into that in just a second here, off on some area you probably have never heard before, so pay attention. But bottom line is, neurologically, that is how your body functions. Your nerve system coordinates function throughout the entire body, top to bottom. There's nothing outside of the control of the nerve system. So, you look at the way that the body is built, and when you get down to a level of, beyond cellular level, you start looking at the subatomic particles and you go even further and further back. What you find is that the body is really made of nothing more than energy. Well, if you understand that, then you see how communication is such a big factor. Because if your body is completely made of energy, if it's not really any stuff, it's just a collection of energy, which we see and perceive as matter, and even what we say feel as matter, then you really come to an understanding that by changing the way that energy is systematically transferred through the body, you're ultimately changing physiology and biology. There's a great book if you want to spend the time to read it. Bruce Lipton, PhD, The Biology of Belief. Absolutely fascinating with the way that the body is, where the research is going into biology and how they're finding the way that energy just drives the entire thing. So, how does your neurological function get offset? One of the big ways is emotional stress. We can say that as relational and emotions and time and worrying about finances and all these other things, just anything that is clouding the head. then that's on the level of emotional stress, and that can cause some major dysfunction, even with the heart. When was the last time that you felt the pain in your chest just because you were under so much stress? You could actually feel it in your chest. Think about the way that's affecting your function and the way that it's affecting your cardiovascular system. There's just tons of research out there to prove the link. Okay, so we got to get that stuff under control. We got to get the emotional stress under control. The next factor is physical stress. Of course, this is chiropractic. This is where chiropractic comes into the picture, because the most common form of physical stress is subluxation. It's literally the bones of the spine compressing on the nerves, interfering with the signals going from brain to body. So you've got the central nerve system going out to all the organs within the body, but if you've got a bone directly compressing, putting force on a nerve, it's interfering with the nerve signals being transferred down that nerve, telling those organs how to function. So of course they can't function that way. So let's look at the heart alone. If your brain cannot function and cannot flow information to the heart, then you're in trouble. There's been many studies that have shown that kyphosis of the thoracic spine actually increases the risk of heart attack dramatically. So when you're hunched forward, causing distortion of the posture, that puts such force on the nerves that now the heart cannot function the way that it's supposed to. So you've got to clear the subluxation, the physical stress out of the body, and keep that clear. It's not something that you can get adjusted once a month, once every 2 months, and hey, everything is going to maintain itself in perfect function. Try brushing your teeth once a month. See how many people want to talk to you in close quarters. Certain things need active maintenance. Exercise. You can't go a week without exercising. It's just not acceptable. So, the last note on there, and kind of goes into emotional stress, I want you to think about the last time that you felt that feeling of being heartbroken. Okay, and this is where we get into just the wild stuff that we're learning in science. Okay, there is literally a neurological connection between the brain and the heart. I mean, this is phenomenal. Many of you know that my wife and I lost a son at 3 weeks old. So of course, when I think of the term heartbroken, I go back to that moment and literally how you feel the pain in your heart, to where your heart itself actually aches. And this is not a feeling, that you're just manifesting. I mean, you can feel the tension and the pressure actually in your heart itself. I know most of you listening to this have heard it before, or not heard it before. You've felt this feeling before. So where does that go? Where does that come from? Well, it comes down to the head-heart interaction. There's an institute called the Institute of Heart Math, and what they're investigating, this is just totally wild. The heart is the most powerful generator of electromagnetic energy in the human body, producing the largest rhythmic electromagnetic field of any of the body's organs, including the brain. Okay, the heart's electrical field is about 60 times greater in amplitude than the electrical activity generated by the brain. This field, measured in the form of an electrocardiogram and ECG, can be detected anywhere on the surface of the body. Furthermore, the magnetic field produced by the heart is more than 5,000 times greater in strength than the field generated by the brain, and can be detected a number of feet away from the body in all directions using squid-based magnetometers. Magnetometers. Yeah. So, I mean, it's just phenomenal that what they're finding in the research, when they get this really sensitive equipment, that they can actually pick up fields, magnetic and electrical fields generated by the heart outward. I mean, we're talking feet, meters out from the body. And in some cases, I recently finished reading a book where they were talking about the latest research. This book was just written recently, that it's even further than that they're starting to investigate with even more sensitive equipment, and finding that they're estimating that our electromagnetic fields could be picked up we're talking like yards away from the body, that across the room from somebody, you're actually being influenced by their magnetic field. I mean, just absolutely mind-boggling when you get down into it. So it kind of reminds me of the movie The Matrix, when they're harvesting humans for the usage as a battery, because of the bioelectrical activity. I mean, it's phenomenal what the body is actually doing on a second-to-second basis. So further in their research, it's shown that the heart communicates to the brain in 4 major ways. Number 1 is neurologically, through transmission of nerve impulses. The brain, the heart actually has it has a coordination of neurons that are unlike most other organs in the body. They basically say that the heart functions like a little brain. That the heart has such a coordinated central nerve system within itself that it practically works like an extension of the brain, and that's where I want you to really pay attention here. So that's the transmission of nerve impulses. So the brain isn't just communicating with the heart is actually communicating back to the brain neurologically. Okay, it also communicates biochemically via hormones and neurotransmitters. It functions biophysically through pressure waves. There's research now looking into the fact that the heartbeat creates pressure waves throughout the body that actually regulates function of other organs and actually controls brain activity as well. And it also functions energetically through electromagnetic field interactions. So communication along all these conduits significantly increases and affects the brain's activity, is what this research is suggesting. I mean, it's just absolutely crazy where this stuff is going. So their studies suggest that as people experience sincere positive feeling states in which the heart's rhythms become more coherent, the changed information flow from the heart to the brain may act to modify cortical function and influence performance. Okay, so I mean, now let's take this off on a different limb. Let's get out of science for a minute, okay? Because some of you say, okay, that's all way too much into science. So let's get philosophical here for a second. The word heart is mentioned 743 times in the Bible. Most involve the heart representing a person's will or desires. The head, on the other hand, is often mentioned when describing rank, source, or descending order. For example, Jesus being the head and we being the body of Christ. Okay? So here's what really it looks like is going on there. When you start looking at that, how does science match up with what it says in the Word, what it says in the Bible? And here's where it gets really fascinating. The heart is really seen on the level of emotional intelligence, where we know for a fact that most people make decisions emotionally. But the reality is you couldn't survive functionally if that's all was going on, because the heart does not control the function of the kidneys per se. The brain does that. The brain controls all the organs. But what is suggesting is that your heart actually has is actually very much in control of emotions. So those emotions, because of the way that they affect the brain and the fact that we know that, for a fact in the research that most people make decisions emotionally, not logically, that in essence, the heart is what's causing you to make most of your decisions. Literally. That it's not a figment of speech anymore. It's a literal thing. Okay, John 14:1 says, "Do not let your hearts be troubled." So think about that for a second. It's not using a metaphor per se, to say, well, your heart, but yeah, we know that it's really your brain. No, literally that your heart is very much in tune with the way that emotions function and work within the body and affect the brain. So very much so, it could be your hearts that are being troubled. Just mind-boggling. So the brain, on the other hand, is a logical and functional intelligence. That's more based on experience and function. But you look at those that are medicated. The people who they use mind-altering medications like ADHD meds and antidepressants, and they literally lose emotional attachment. because it's blocking out their body's ability to, to access emotions. But yet their body still continues to function, and I mean it still stays alive and everything. So really what you're seeing two things there, that the heart brain actually controls, actually deals with emotions and decision making and will and all these other things, but the brain heart, because of course we have to look at the way that the heart is now affecting the brain in terms of heart rhythm and the electromagnetic fields, that the brain heart actually controls all of our function. So what it boils down to is that your brain and your heart are tied in more than we ever knew before. That really those two organs are absolutely the center core of the body and the way that it functions and the way that it works. And you can't really reduce that down to any lower level or any lower way of thinking. And when you really see that, when it really starts to freak you out is when you see studies where there's examples out there of people getting heart transplants. And think about this for a second. First of all, your heart can be removed from your body and continue to beat on its own, and then it can be put into another body and continue to beat on its own without the influence of that person's brain. That's because of that little brain within the heart. It's that it will actually continue to do its, it'll continue to do its job for a certain amount of time before it needs to lock into the brain and start working more functionally. Okay, but they actually have documented cases where people get heart transplants and they get the new heart from somebody, and all of a sudden they start experiencing memories from the person who they received the heart from. So these are not things that were in their experience, but they start experiencing dreams and sometimes live waking memories that are actually involved in that previous owner's life. So we're just really beginning to tap into the very beginning of this, and I'm sure as time will move on that we're going to prove that all organs have a similar relationship, because of course the body is one unit. It functions as one unit. You cannot remove any one part and keep it working as a whole. So, that I hope all that wasn't way too far over anybody's head, but I think it's just fascinating, and it gives us a different appreciation for the way that we take care of our body and the way that we take care of our hearts and the way that we think of our heart. Knowing the way that works, do you really want a doctor cutting into your chest with a scalpel and then using metal clamps to spread your rib cage apart after sawing through your ribs so that they can get in and cut and paste different valves and and arteries in to bypass one point and into another, and all this crazy stuff that's going on with heart surgeries? Do you really want somebody doing that? Is that worth the ding-dongs and ho-hos? I really doubt it. So what to do? Number one, realize genetics are no longer an excuse, and accept responsibility. Okay, I'm going to repeat that again. Realize that genetics, the way that your body is, the way that, my daddy had it, that's no longer an excuse. We're way beyond that in the science today. We know that is not a factor, a significant factor. It is personal responsibility that drives that drives the way all this stuff functions. So in knowing that, when you take responsibility, that's when you can throw away the drugs, because you really come to realize that you're the only one that can change anything, that all you're doing with the drugs is just delaying the problem, making it worse, and killing yourself faster, so you can start to do something else instead. You can start to restore maximized function. You start living the maximized principles. Start dealing with the nerve system, start dealing with your mindset, start dealing with toxicity and your diet and exercise, the things that we know beyond any shadow of a doubt. These are the core factors that will change any health situation, period. You can't do it any other way without addressing those 5 core things. So, as featured on WebMD, George Bacris, MD of the University of Chicago Hypertension Center, showed that chiropractic allows healing, and it seems to be, it allows healing at all cellular levels. This procedure has the effect, this is a quote, this procedure has the effect of not one, but 2 blood pressure medications given in combination, and it seems to be adverse event free. We saw no side effects and no problems. Can I say that's true? Absolutely, because I can't tell you the number of patients that I've had in the last number of years that have been able to lower and get off of their blood pressure medications simply because of one thing. They started getting chiropractic regularly. They stuck to their appointments, they made their appointments, they were working on their spine, they were keeping their nervous system free, and sure enough, their blood pressure starts dropping down. On the same note, we saw no side effects and no problems. Well, I've adjusted well over 50,000 patients in the last number of years since opening as well. And I don't have a single case where somebody has been seriously injured. So I think 0 in 50,000 is a pretty good track record there. So the next thing that you do beyond chiropractic, is you start to supplement the process, okay? And I want to make that very, very clear as to get no misinterpretation of that period. Only one thing in the body can produce function. That is the brain and the nerve system, okay? Producing function. Now, once you produce function, you have to support function. That's where all the other stuff comes in. That's where exercise and detox and nutrition comes in. But those things alone cannot produce function. They cannot make the body function. Otherwise, you could put all that junk into a dead body and watch them rise from the dead and be in good health. It's not going to happen because health only comes from within. That is the most important factor. Until you get that, then chiropractic is just going to seem like another modality, another treatment, another process, another protocol. And might as well just take some vitamins because, hey, they're cheaper and they don't take time. But that's not the way it works. It's never going to work that way. Only one thing produces function. That's a brain and nerve system. You take care of that first. You add in all the other stuff to support it. So, NeuroCleanse on that level, that actually works to reduce the toxic load from the body, which reduces inflammation of the body, which will help to restore the normal function of the body and the arteries and everything. So that's a good, worthwhile approach. On that note, we are pretty soon here. We are going to be having a reformulation of NeuroCleanse. They're actually coming out with a better formulation that's just tweaked. And the good news is they say the cost is going to be coming down too. So definitely keep your eyes out for that. The next thing is surge training. When you surge train, you're burning up sugar within the body at the most effective rate that you possibly can. So when you do that, you're reducing inflammation. Because you're clearing out all that sugar that's in your bloodstream and in your cells. So the ages reduces, which reduces the inflammation. So now your cholesterol and blood pressure can come down also as well. You see how that works? Okay, the next step is the advanced diet. The advanced diet eliminates all incoming sugar, period. You're getting rid of all the sugar coming in. So with the surge training, you're getting rid of what's already there. But with the advanced diet, by eliminating all sugar from the body, you give your body a chance to get rid of sugar congestion and heal the pancreas. Let it start producing insulin properly again. So make sure that you get into your patient manual and read about the advanced diet and get, if you suffer from any of these factors, if you've got high blood pressure, high cholesterol, high triglycerides, diabetes, any of these, it is, you cannot choose here. It's not a matter of do you have a choice of to do it or not. You need to be on the advanced diet and doing these steps immediately. You don't have a choice. It's beyond that point of choice. This is what they call the death zone. If you're climbing Mount Everest, there's a certain point where beyond that point, you've only got a certain amount of time before your oxygen supply runs out in your body because you literally cannot breathe it in fast enough. So once you're in the death zone, you've only got a matter of days to get to the top, finish, get back down to the bottom. if you have any of those issues, you are in that death zone. Realize it now. This is my warning. As a doctor, I'm trying to warn you. You are in that zone. I don't care if you're getting chiropractic. If you're taking blood pressure medications and cholesterol, and it appears that your numbers are lower, you can't be happy with that. You need to be off the medications, off the cholesterol drugs, off the blood pressure medications, and your levels still be normal and be under chiropractic. That's when you know that everything is okay. But until then, you are in the death zones. Realize it. Do something about it right now. Okay, moving on through a few other ones of these. And please, guys, if you're taking blood pressure and cholesterol medications, do not go to the health food store and just buy all these things and add them to your list of things that you're taking. You're not doing anything by doing that. If you're just adding to and adding to, you're not getting anywhere. You're just running in circles. You got to take care of first things first. Once you take care of first things first, you're off the medications, you're doing the right lifestyle changes, then you can add in L-arginine, magnesium aspartate, and grapeseed extract. These increase production of nitric oxide, which allows for dilation and relaxation of the arteries. So it actually allows your arteries to relax, go into a stress-free configuration so that blood can pass through them freely. Now, this is something that you can actually help to mimic the action of insulin and shuttle glucose into the muscles to burn even faster. If this would be in a case where somebody is diabetic or has blood pressure or any of those issues, and they're again off the medications, but they're doing surge training. You could take tannic acid from banaba leaf. That's BANABA, banaba leaf. And what that does is it mimics insulin, so it actually pushes sugar into the muscles so that your muscles can burn that sugar more effectively. So really good if you were doing surge training, because you're going to burn it a lot more efficiently. You don't have to work out as long, even though 12 minutes is not too long anyways. If you haven't seen anything on the surge training, get on my website at www.drbucknell.com. That's DRBUCKNELL.com. And you can read all about surge training. It's in the section on 12-minute revolution. So that little the banaba leaf, that's definitely one of those that the drug companies do not want you to know. So all of this put together, let's just summarize it here. When you look at yourself, obviously you know what changes you've got to do for yourself, but how many of your family are going to die because of these lies? I mean, think about it. How many of your family right now are already taking these medications? And here you are sitting back saying, well, I know it, but yeah, I don't really want to force it on them. I mean, they've got to make the decision for themselves. They've got to be able to decide. They've got to make a choice. If that's the way they want to live their life, then that's okay. I'm just not going to interfere. I don't really feel comfortable telling them, so I'm not going to tell them. Well, bottom line, facts are facts. It doesn't change the facts, whether they want to or they don't want to. It is our moral and ethical responsibility to proliferate the facts to those that we love, especially when their lives actually depend on it. And I'm going to go beyond that in quoting Proverbs 18:9. It says that one who is slack in his work is brother to one who destroys. Okay? So one who has information that can change somebody's life and holds on to it because they're lazy or because they're non-interventionist, then what they're doing is they're actually, that actually says that you are brother to one who destroys. You are holding the hand of the very one that's killing them. So let's put it in real time. You've got the drug companies over here that are giving them medications that are not helping the problem, that are actually making the problem worse, and they're going to die at the hands of those medications. And then you've got you over here with the information that could change all that, but you don't really want to interfere or get involved in their decision making or push them in any direction. Well, basically what that says is from a spiritual standpoint, you are holding the hands with the drug company. Instead of holding hands with the person that you love and you care for, you're holding hands with the very one that destroys. So this is not something that we can play lightly around. It is our morally, ethically, and spiritually responsible calling to make sure that those around us are taken care for, and that they get the right information when the right information is available. So I'm going to ask you to do this. I'm going to ask you to pass this disc to somebody that you know. Okay, somebody that, as you're listening to this, that you know somebody that is taking blood pressure, cholesterol medications. Pass this disc on to them so that they can listen to it, they can get all the information and start to take the right approaches to start dealing with the issue the right ways. Now, let's say that you got this disc from somebody that cared about you enough to give it to them. What do you do the next step? Well, you can do one of three things. You can call my office, 251-607-0040, or you can email me at drbucknell@gmail.com. That's DRBUCKNELL @gmail.com. And what we'll do is we'll try to get you plugged into a community dinner or a patient appreciation event, or at the least, we can definitely get you in expedited if one of those events are not anytime soon. But our community dinners, those are designed to be able to get your friends, your family, anybody that you care for to a dinner to hear the basic principles of chiropractic and maximize living, what it's all about, how to put the 5 essentials in, what healthcare and medication is doing to them. It's to get in there and be an intervention and be able to change their lives in a non-confrontational environment. We basically take them out to dinner, so if you have not been to a community dinner, you have not done your community a favor. Okay, and I say that boldly because we've got a lot of patients who have never been to a community dinner, or who have a lot of people I'm sure that they could bring that they still have not brought. On the other hand, I have some patients who have literally been to almost every single dinner and have brought 50, 60 people to dinners. I won't embarrass them and list their names, but you know who you are. So if you're one of those that has never been to a community dinner before, has never brought anybody to a dinner, I don't even know what to say about that. It's mind-boggling to me, because this is not about business. It's not about chiropractic. It's not about practice. It's not about me. It's not about my family or a mortgage or any of that crap. It's about saving lives. It's about getting out there and making a difference in the community, because there's people around us that are dying, and they're going to the hospitals sick, and they're getting sent home with no choice other than take medications and get surgery for the rest of their life. We just can't stand back and let that be an option anymore. It's time to change. Our environment in this community has got to change, and the only ones that are going to do it is the ones that actually get the information, the ones that are blessed enough to have the opportunity to understand the principles that we have to share. So I'm just going to tell you one more time, if you have not been to a dinner, you call the office and get a group of your friends to the next dinner that's available. Turn their names in up front. I don't even care if we have to do the work for you. That's fine. But get them to a dinner, because it's not about you. It's not about me. It's about saving lives. So lastly, if you guys have not checked out the website lately, get online at drbucknell.com. That's, again, DRBUCKNELL.com. You'll see that they completely reformatted the website. It's much, much easier to use. Make sure you check up on the blog section regularly. These audio workshops I do post in the into the archives on the website, so you can actually listen to them online as a podcast. So, there's another option. If you've got friends that you want to listen to this, you can send them the link to my website, and they can just listen to it online, even if they're somewhere around the world. We do have listeners that are in other countries as well. So Just utilize the resources that are there as much as possible. And definitely I want you to be excited about next month's audio workshop, because I'm going to be talking about the most important thing that we could ever discuss, the principle. We're going to be talking about the chiropractic principle and how important that is to your life and what it's going to do for the rest of your life. So make sure that you pick up March's audio workshop when that comes available, and listen to it as many times as you possibly can fit in, because it will absolutely change the way that you look at your life and health from this day forward. So that's going to be it for today. If you guys have any additional questions, feel free to email me at drbucknell@gmail.com. I am here all the time for you. I am here to be not just your doctor, but your coach. I want to help you. I want to see you live a better life. Chiropractic would be boring if it was just about fixing back pain and headaches. It's about changing lives radically in a completely new way that we can see people live to their full potential and get the most out of life and serving their God to the greatest abundance possible. So get out there, make a difference, make a change, and I'm here for you every step of the way.